also be done for the patient whose general appearance is about height is 156 centimeter, weight is about 50 kg, and her BMI is about 20.5. So skin is healthy, wrinkles present, and no sores are observed. So incisions won't present in the right femoral region, and also central nervous system. There is a level of consciousness, and the oriented to the time and place. Speech is relevant and appropriate. So the respiratory system also be noted. Chest movement is bilaterally equal, and respiratory pattern is about breathlessness in oxygen therapy, and air entry is about bilaterally equal. Breath sounds also be normal, no cough, and oxygen level also be 21 minute via nasal cannula. In our cardiovascular system, heart rate is about 66 beats per minute, and BP is about 100 to 60. Peripheral pulses are present and normal. Heart sound is both S1 and S2 are heard. So chest pain is here, mild pain and mild sternal regions to the mid. And gastrointestinal system, there is no oral ulcer or dental caries and persistent with staining, and nutrition route is oral. So here once again the CBC also, laboratory test also be done. CBC hemoglobin is about 12.8, and patient THS level also be normal, 0.324. Here the ECG report is about ST segment elevation, that is ST elevated MI. Here the evolution of ST elevation MI. One is normal, second one is hyperacute, that is a tall T wave. Third one is ST segment elevation, baseline elevation. Fourth one is ST segment elevation and also with the presence of Q wave. And the fifth one is about ST segment elevation, T wave inversion. The last one is recovered days, that is week or month later T wave become recovered normal stage and presence of Q wave. And patient having ST segment depression in reciprocal areas. Here the horizontal downsloping depressions also be noted. The one is horizontal depression. The reciprocal to the elevation elsewhere widespread to the depression and suggested multivessel disease and left main occlusion. In posterior wall MI, ST depression in V1 to V3 can be noted. T wave, it is about T wave morphology, which is normal or hyperacute, biphasic or notched. Here the patient does not having any notched at all, only tall T wave is noted. So inverted T wave become uprighted during ischemia is also called as a pseudo normalization, but in here patient is suffering from acute MI, marked ST elevation and Q wave formation, PR depression. So it is only present in lead 2, lead 3 AVF. So it is also called as myocardial infarction and inferior wall MI. Pain also be noted. So mostly significant is about PCI thrombolysis can be permitted, or if it is ST elevation made with the criteria and symptoms also. Here patient is planned for PCI. So it is extent of STT changes correlated with infract sizes. So the post perfusion predict good outcome. Complication is about persistent elevation and ventricular aneurysmal widespread changes, or maybe sometimes leads to cardiogenic shock. In order to avoid these complications, patients are treated with using ecosprin, aspirin, and clopidogrel, atorvastatin, antiplatelet drugs, and statin drugs are given. Amoxicillin for antibiotic, nitroglycerin for pain vasodilator for pain controlment, and low molecular weight heparin for anticoagulant purpose. Patients are now subjected to the CCU for continuous monitoring, and the vital signs are being noted every 2 minutes once. Then the stress echocardiography also be planned for further evolution for maintaining a myocardial perfusion, and also reading whether it is triple vessel disease or double vessel disease. It can be able to remodeling or what, and further process also be processed for if any complications in futurized. The CRT also will be planned side by side. Thank you all. This is about the case study of myocardial infarction, and types of MA also be learned. Thank you all.